Engaging in active reading is crucial for expanding medical vocabulary. Professionals should pay attention to context clues within texts, using surrounding information to deduce the meaning of unfamiliar terms. Active reading. Active reading is an approach where the reader consciously and purposefully engages with the text. It involves more than just passively scanning words on a page. Instead, the reader actively interacts with the material. Here are some actions performed when you interact with the text. Annotation, questioning, summarizing, visualization, connection to prior knowledge. Annotations is where readers can underline, highlight, or jot down notes in the margins to identify key terms, concepts, or passages that require further attention. This helps in creating a personalized reference for future review. In questioning, readers should ask questions as they progress through the text. This could include queries about unfamiliar terms, seeking clarification on complex ideas, or pondering the implications of presented information. Questioning promotes critical thinking and a deeper understanding of the material. Periodically summarizing the main points or concepts helps reinforce comprehension. Creating concise summaries in one's own words aids in internalizing information and retaining key details. Visualization. Forming mental images based on the text can enhance understanding. For medical text, visualizing anatomical structures, biological processes, or medical procedures can contribute to a more vivid and lasting grasp of the material. Connecting to prior knowledge. Relating new information to existing knowledge is crucial. Active readers draw connections between what they are learning and their prior experiences or understanding, facilitating the integration of new vocabulary into their existing mental frameworks. Context clues. This refers to information in the surrounding text that provides hints or cues about the meaning of an unfamiliar word or concept. Healthcare professionals can use context clues to decipher medical terms they encounter. Some clues include definition in the sentence. Sometimes the meaning of a word is explicitly stated in the same sentence or a paragraph. Authors may provide definitions or explanations within the context to help readers understand unfamiliar terms. Synonyms and antonyms. Words with similar or opposite meanings may be used in proximity to unfamiliar terms. Recognizing these relationships can aid in deducing the intended meaning. Examples or illustrations. Authors often provide examples or illustrations to clarify complex concepts. These examples can serve as context clues, offering insight into the application or manifestation of a specific term. Word structure. Analyzing the root, prefix, or suffix of a medical term can provide clues to its meaning. Understanding common medical affixes helps in breaking down complex terms into more manageable components. Surrounding sentences or paragraphs. Reading the sentences or paragraphs before and after the unfamiliar term can offer valuable context. The author may provide additional information that clarifies the intended meaning. By actively engaging in reading and utilizing context clues, healthcare professionals can enhance their comprehension of medical texts, allowing for the efficient acquisition and retention of medical vocabulary. Shown here are some healthcare terminologies commonly used in clinical notes at hospitals, along with their brief explanations. These terminologies are commonly used in clinical notes to communicate essential information about a patient's health, assessment, and treatment plans among healthcare professionals. Let's implement these techniques mentioned here using a passage. First is to annotate or In this case, highlight the words listed earlier. Next is to figure out the meaning of some of them, like chief complaint here would mean the main problem. Some of these terms needs to be understood from the context as well, like discharge summary. The definition of discharge summary is given right after the word discharge summary, which includes the outlined diagnosis plus treatments and post-discharge recommendations. Some others can be understood based on prior knowledge, which changes from person to person. For me, I understand renal is related to kidney, and hence renal failure would mean kidney failure. Now, in scenarios where you're writing an assessment and have limited time to answer questions, you would still need to build your vocabulary, even if you apply all the techniques that is mentioned here. Expanding medical vocabulary serves as a foundational reading technique for healthcare professionals. The benefits extend beyond individual proficiency, influencing the efficiency of reading tasks, the comprehension of complex medical texts, and the overall effectiveness of communication within the healthcare domain. Embracing a commitment to continuous learning and vocabulary development is not just a professional enhancement but a cornerstone of effective healthcare practice. Active reading strategies. As mentioned earlier, active reading refers to an engaged and deliberate approach to reading, where the reader interacts with the texts, critically analyzes the information, and makes an effort to understand, question, and remember the content. It involves mentally processing and responding to the material actively, rather than passively absorbing the message or words on the page. Few of these methods I elaborated using a passage. Some others are preview the document, which is skimming through the clinical notes to get an overview of the content. Identify key information. Determine the main purpose of the clinical notes and identify key information such as patient demographics, chief complaints, and relevant medical history. Define medical terminology. Actively engage with medical terminology. If you encounter unfamiliar terms, take the time to define and understand them. Connect information. Pay attention to the relationships between different pieces of information. Connect symptoms to diagnosis and treatments for a cohesive understanding. Visualize concepts. Create mental images or mental associations to aid in understanding and remembering complex medical concepts. Summarize paragraphs. Periodically pause and mentally summarize the content of paragraphs or sections in your own words. This ensures active engagement and reinforces your understanding. Use context clues. Rely on context clues to decipher the meaning of ambiguous terms or phrases. The surrounding information often provides clues to the intended meaning. Stay focused on the patient. Keep the patient in mind throughout the reading process. Understand their journey from symptoms to diagnosis and treatment to maintain a patient-centered perspective. Reflect on implications. Consider the implications of the information provided. Reflect on how certain details impact the overall patient care and management. Revisit and review. After completing the initial reading, revisit key sections mentally for reinforcement. This can enhance your understanding and retention of critical information. These strategies align with the nature of the OET exam, where candidates are required to read healthcare related texts and respond to questions within a specified time frame. It's a matter of implementing these strategies during your practice in order to quickly find the answer you're looking for. Consider showing your support by liking this video, subscribing to this channel, and commenting on what you think our next video should be. By doing so, you are also helping us grow. So show us your support, and until next time, take care.